Alright, in this short video we'll take a look at some massage techniques applied to the lower back. This situation here will probably be typical for many physio settings where your patient, if they are female, has on a bra and shorts. So what I'll be showing is ways to work this area segmentally, but do keep in mind that the paraspinals, of course, really benefit from the full length of their work, but for the video we'll show it in two segments, starting with the lower back on this one. So we will be using an oil product. So at least for the shorts, we're going to use a towel tucked just below the level of the sacrum, and we'll get a little bit of massage product. And we'll start off with getting that applied to the lower back region with some effleurage. I should make note that the table that I'm using does not have an electronic adjustment, so the biomechanics you see on this demo might not be ideal for the height that I could or should be using. So effleurage I'm applying to both sides of the back. You can also apply it to one hand. Remember, effleurage is where the hand stays relaxed. You follow the contours of the body, trying to cover the whole area. Now normally I wouldn't do effleurage across the body, just mostly because of my own body mechanics, but for this video, just to be able to see a little bit easier, I'll be doing a number of techniques across the body. So hands are relaxed. Here I'm just showing effleurage with a hand supported on top. But you certainly can just use the one hand to do effleurage on the one side of the body, or both. A couple of other tools that we'll be having you practice with for effleurage are loose fists. Remember, effleurage, the stroke in this case, we're moving up the back with a bit of pressure and then just a very light return. You can take your effleurage stroke a little further lateral. Again, I'm just showing loose fists, and you can get quite lateral with both of those. You want to experiment with which tools feel best to your body. You might prefer just using your hands. The other tool I'll show on my side anyways is using the forearm for effleurage. So again, not a lot of pressure for effleurage. We are just acquainting our touch to the patient's body, getting them used to that. Spreading the lubricant, and in a lot of cases you can just use effleurage as a nice in-between stroke for a variety of techniques. When you use effleurage, when you use your forearm to effleurage, try to just keep your wrist and hand relaxed as opposed to a tight fist. It changes the dynamic of the tension in your own arm as well. Okay, let's do some palmar kneading. So palmar kneading, we know, is circular. The pressure is on the up part of the stroke in a circular manner. We come back down and start again. I'm showing both sides on either side of the vertebral column. You could certainly palmar knead on one side. I have to watch my wrist mechanics there a little bit. Okay. And you can certainly use finger kneading. Here I'm showing two just up the paraspinals. Circular the whole way. And then I'll show thumb kneading on this